Hello, everyone. My name is Nanette Hirschberger, and I am a fourth grade teacher in Rockford at Crestwood Elementary School. I want to welcome you all to our first Children's Mental Health Workshop hosted today by Dr. Deb Havens. Deb Havens is here with us, and she is running for Kent County Commissioner in Plainfield Township and also Rockford. We're lucky to have Deb hosting us tonight in this event. She has taught high school and in the university classrooms and has a doctorate in educational leadership. She comes with a lot of experience with children elementary all the way up, and she is the only candidate running for the Kent County Board of Commission who has an educational background. I am pleased to introduce to you my friend and colleague, Dr. Deb Havens.
Oh, thank you, Nan. And thanks to everyone for joining us this evening. I decided to host this discussion because I know parents are very concerned about plans to reopen schools, especially after so long in shutdown. And I also know that children's mental health issues may arise from a number of factors, and we'll discuss an overview this evening. But recent worries for children's mental health, certainly in the age of COVID-19, we know may have been increased by the impact of isolation from friends and family, the stress of online learning, upset caused by overnight changes in the lives that we're leading, and sadly, even the possibility of a loss of a family member or loved one during the pandemic. So I'm very pleased that with me tonight to discuss the resources and to answer your questions about children's mental health are adolescent and elementary childhood mental health professionals, Jenna Shapiro and David Jangda. And I'd like both of you to take a moment to give us an idea of your past experience. So David, let's start with you. I understand you primarily work with adolescents.
Yes, thank you, Dr. Havens. Yes, I do work with primarily adolescents in Rockford Public Schools currently, but I do work K-12. So I do work in the elementary setting as well with colleagues like Jen and other professionals, school counselors and school social workers. A lot of my background is clinical. So I worked at Pine Rest about 14 years in a clinical setting. So I worked in a locked residential unit, an unlocked residential unit, all with adolescents. So in those settings, we're a lot more intensive support systems. So we were able to see students that were struggling with more pervasive issues, still, educating them, still working on their mental health. And then I transitioned to a school-based setting about 8 years ago, where I was working in Grand Rapids Public Schools, at Ottawa Hills High School, Gerald R. Ford, Alger Middle School, and several GRPS schools. And then I was able to transition to Forest Hills Public, and I was also K-12 there on all three sides of their district. And then this past year, I transitioned full-time to Rockford Public. So I work, like I said, alongside with some great colleagues to help support our families, our students, and our staff here in the district.
Excellent. Well, Jenna, let's turn to you now. I understand that you have childhood experience along with adolescence. So fill us in a little bit.
Yes, thank you. So I am from Wisconsin. I was born, raised, and educated in Wisconsin. And so my licensing looks a little bit different there than here in the state of Michigan. And my background has been in kind of half schools and half clinical type mental health settings. But all that experience has been with children and young adults. And so I've worked in a variety of settings. As you see on that slide, I was a sexual assault therapist. I was a camp assistant director. I've been in various schools and worked with people with severe and persistent mental health. And my role has been more of the transition back to everyday life and how to develop skills to be successful in your life, along with coping and managing your mental health.
Well, I'm very glad to have both of you join us this evening. And one of the first questions I'd like for us to clarify is the situation that mental health issues in children do not mean that parents have done something wrong. Can we explore that a little bit?
Absolutely.
Yeah, Absolutely. The fact that a child may be struggling with a mental health issue is not necessarily directly the result of bad parenting. There's a variety of different factors. So there's obviously the biochemical, the physiological piece of it, genetics, environment is part of it as well. There's a lot of factors that go into somebody struggling with mental health issues. And a big thing for me is mental health issues are normal. Anxiety is normal. So is depression. People are going to have bouts of it to a certain level. It's not really classified as a disorder unless it becomes debilitating. So anxiety, we can have driving a car, right? Like a deer runs out in front of us or it's heavy traffic. We're going to be anxious. We're going to be nervous. We may be sweating. Our minds might be racing a little bit. We might have some of those signs and symptoms. It doesn't mean that we have a clinical diagnosis and we need like really intensive treatment. It only gets to that point is if my anxiety is so high, I can't function or drive a vehicle or make it to work or do those things because I've had bad experiences and I'm not able to function. That would dictate the fact of needing more intensive support. So no, in no way, Dr. Havens does parenting directly result in it. Now, is that a factor in it? If something is not, if children aren't supported, if they're not given their basic needs, if they're not adequately given, what they need developmentally through their stages, of course it can contribute, but it's not the direct result. So if your child is struggling, please, this is something we need to do together to work through that. What I always tell parents is it's not the fact that our kids are going to have mental health issues, it's what we're going to do with it. When they have them, those parents are stepping up and working with their children and working with professionals to get adequate treatment. That's why I feel parenting is so important.
Jenna, would you like to add to that?
Yeah, I'll kind of explain what we're looking at on the screen now. This is how I approach servicing and supporting our families and our children specifically within the school setting. So what I do in my job is going to be in that one blue sphere of school. And for some children, their anxiety, their mental health issues, they're going to be focused on their time spent in school. Some are going to be at home and some are going to be as a larger community issue. But if we don't address all of these areas, then really we're not going to be addressing the needs or getting at the root of the problem.
And I think we all know right now that the situation with school shutdowns and the uncertainty around COVID-19, that really has added to the stress and anxiety that may bump it up beyond something that is easily dealt with. David, would you like to comment on that?
Yes, thank you. Dr. Havens, you're exactly right. I believe you hit the nail on the head earlier when you just said the abrupt overnight change. That, I believe, was significant for not only for children, but even for adults. So the increase that we're seeing in anxiety, and we have to remember anxiety, trauma is an anxiety disorder, right? So when we go through significant life changes where our worlds are turned upside down, for many of us, it could be a level of trauma that we're not even aware of. So to have an increase in anxiety is very normal when it comes to situations like a pandemic, like things that are happening on this grand scale. So some of those factors are directly a result of just losing our routine. So for our students, they directly were impacted because their normal day-to-day life was changed almost abruptly in the next day. Things like sports, art, band, extracurricular activities, things that they were involved in to help cope, manage, and balance their lives was taken from them. So this was very, very difficult for everybody to cope with and manage. Socializing, we know for adolescents, socialization is so important. Their whole life typically are their friends, hanging out, doing things after school, during school, all those things. So having that taken from them as well was one of those things in their life that they were super dependent on for their mental health and their well-being. Planning for the future, not knowing what to expect for all those months or even now. How are we going to get back to normal? What is my season going to look like? Am I going to get into college? What does next year look like? There's all these questions that were uncertain for so long that level of uncertainty creates anxiety because it's a fear of the unknown. When we look at the definition of anxiety, it's what it is, the fear of the unknown. And that's what COVID gave us, was a fear of the unknown, especially if we watch the news, certain media outlets, things, we weren't sure what was going on or what to expect. And then unfortunately, when people were stricken with COVID, if they became sick or they lost a loved one, the direct impact that this had on our community, our families, and even family members or friends was huge.
And so we find that there's an increase in depression. When does this become something that we really need to worry about? Jenna, would you like to explore that with us?
Sure. And I just add a little bit to what David said too, that this was a huge loss of trust because kids and families expect that school's going to go on. We know when our school breaks are. We get that schedule at the beginning of the year. I know what I'm planning for April, May. And so that really abrupt of like, well, you say school's tomorrow, but will it be? You say that I'm going to be fed today, but will it be? And so really what David was talking about earlier, when you lose that functioning, when you lose the ability to cope or handle any day, everyday stressors. So things like you're avoiding, the more that we avoid things, and we end up not being able to handle any sort of stress. That anxiety is going to get worse and worse and worse the more that we ignore it and the more that we don't process or validate those emotions.
So you're drawing a connection between anxiety that can lead to depression that is more aggravated than just, say, driving anxiously in your car that you just missed hitting a deer.
Mm-hmm.
Absolutely. And a lot of us don't know, we'll feel like our regular anxiety, and sometimes you don't know that you are really, really in need of help until you've driven off the road and you're in a ditch or you're sitting in your car crying because you can't handle it. So a lot of this is going to be looking at our families and friends to check in on each other and be like, how are you doing? Because we don't have a lot of time to check in with ourselves of really how serious has this gotten? What do I need help with? And a lot of that vulnerability of asking for help isn't something that's reinforced so frequently. So I know that our next slide that we're coming here is kind of what can we do and what are our next steps going to be? And a lot of that is going to be talking and listening.
Yes, because I'm sure that in some respects, we're talking about the fact that parents can help their children through conversation, but parents are also dealing with these same stressors.
Mm-hmm. And that's a great point, Dr. Havens, to be aware of our own impact and our own reactions to all of this. I think a lot of us as parents, we're really hyper-focused on the well-being of our children, as we should be. But we also need to keep in mind, how are we managing this? How are we coping with our own self-care? Because what we do is going to transfer to our children. So if we're confident, we're healthy, it's a better chance that our kids will be. But if we're not functional and we're struggling with all of this, they're also going to see some of that, and we're modeling that to them. So I tell this to teachers as well. When they're in the classroom, their level of confidence and well-being to their students is going to really reflect onto them. Otherwise, they're trying to gain confidence from us and watching what we do with children. So, and the unique thing about COVID is that it started out as kind of almost like acute trauma. It was this situational, started, and then it turned into almost chronic trauma because it continued. We'd almost, like Jenna was alluding to, we'd get to a point and then it would be like, is this going to be okay? And then we'd switch a phase, and then we would get, things were getting canceled. This has been ongoing for several months. So people have a certain level of almost post-traumatic stress that sometimes they're not even aware of. And now that we're going back to the setting, I think people are very concerned that what if we close again? What if we do go down in a phase? People are very, very hypersensitive to the fact that if we go back down, the reaction could be pretty hostile and pretty scary.
And another thing that we've talked about is the anxiety with COVID. And anytime you cough or you get a headache or you need to sneeze, people are going, oh my God, do I have COVID?
Yeah.
Or, oh gosh, does that person have COVID? And it makes you not trust yourself, and it makes you not trust the people around you. And so that's even isolating on top of this quarantine and stay at home that we've experienced.
Now, we have quite a list of how anxiety can manifest here. Mm-hmm. Is there something that is predominant or something that is more likely to be identified with an anxiety that might be leading to more serious problems?
The thing that stands out for me that I would like parents to know is anxiety can really manifest itself very similar to ADD and ADHD symptoms. So those two different diagnoses can often be mistaken because a child with inattention or with hyperactivity or focus issues, they're going to be distracted. They're going to be fidgety. They're going to be off task. They could be irritable. They could have behavior issues in the classroom. Those things can look that way, but also students, because of everything that has gone on in the past 6 months, that's what anxiety looks like as well. So to me, those are the symptoms that might stand out the most because they may be the most common and the most detrimental in the classroom or even at home, because we're probably looking at our kids like, why are you always on your phone? Why are you so irritable? Really, it's that constant ruminating stress that's going on and their thoughts racing of the unknown. It looks like ADD, ADHD, but really it's just that high anxiety and that fear and stress of what is going on and what's next.
And with that some of these things, our kids might get used to things not knowing what's happening. They may get used to this, and then one thing goes out of line, and that's the thing that they can't handle anymore. So those outbursts or getting very irrationally mad about one thing or refusing to do something flat out that they've been doing forever, those are things that are completely unexpected. But if you can look at this list and be like, oh, yep, okay, I am expecting this anxiety. It may look like a whole bunch of different things, but yep, there it is.
Can you explain what a somatic complaint is?
Yeah, those are going to be physical symptoms. So that could be tummy aches. It could be a headache. It could be increased heart rate. It could be sweating. A lot of kids report the most common is the kids will have stomach ache, especially in the morning on their way to school. They'll just be like, I don't feel good. I might have to go potty. I have to eat something. They're going to feel all those things. And typically what that could be, it could be anxiety. It could be the cortisol, stress hormone being produced that can really irritate the stomach lining and other things and create some of those somatic symptoms. So those are just physical symptoms.
Can you identify which of these manifestations might be more common in an elementary school child versus an adolescent?
Sure. This list, I have seen that every single one of these in elementary school children. Now, obviously, the scary themes in play, or something like if you're seeing kids playing with superheroes quite a bit, or that's increased, or the idea of death, someone needing to be saved, destruction, those types of things, I think that's going to pop up more often in young kids who are kind of playing, and you can see that. The somatic complaints, again, that could be things like constipation. That could be things like refusing to eat foods because it upsets their stomach more. So that might be something in younger kids that they really are physically ill and they don't know why and they can't connect it there, but they're saying, I really do feel sick. And there's really no connection other than it is anxiety.
So some of the things.
I'm sorry. I would say with the elementary students, I would say some of the focus issues, attention, behavior, they're not able to really communicate and articulate themselves as effective, obviously, as adolescents. So you may see some of the things that are going to be more consistent with just acting out and having behavior issues in the classroom, or defiance, just saying, I'm not doing it, and they're kind of checking out and we don't know why. With the teenagers, what we're going to see is more of that, maybe aggression, skipping school, having some of the somatic stuff as well, sleeping all the time or not sleeping at all, substance use or substance dependence. We're definitely going to see an increase in that because that's going to give a little bit of euphoria to them. Hanging out with the wrong crowd, their grades are dropping, attendance issues, things like that are going to show. And to me, those are signs that there could be an anxiety issue, an underlying mental health issue.
And can you speak to how this might have shown up more commonly with remote learning circumstances?
Yeah, that was quite a transition for our students, and it was pretty abrupt again because they weren't planning on that. So with a lot of students, they struggled with learning that way, and they struggled with the structure of it all, or even with the technology or having it. So we felt that there was a lot of frustration or some frustration around that. So with frustration and with kind of abrupt changes, you're going to have increases in anxiety. So we've seen students that weren't logging on, engaging, students that were upset and super frustrated with, the fact that they had to get this academic stuff completed via an online venue. So all those things had heightened because almost overnight they were expected to do an online program, but the district did as much as, as we could to be able to support that as well as we could with our staff to check on students, make sure they had the resources, let them know we're here to help them. And that's why we're more equipped now going into this fall, because we understand before what we learned, and now we're trying to be even better.
Okay, well, I think one of the things that some of the people watching tonight would, and probably everyone would want to know, what are some of the things that parents can do to actually help kids deal with what we're going through right now?
Yeah, I think one thing is just patience. I mean, it sounds pretty basic, but I really feel that just being patient with your child, and like Jenna and I put on here, listening, like just being there to hear them out and validating how they feel. Sometimes just hearing our children out, no matter what their age is, and being like, we understand, yep, this does sound very frustrating. We're going to get through this. We're going to figure this out. Giving them confidence and reassurance is huge. And when we're looking at structuring an online academic program for them, it's consistency. Kids like structure. As much as they may say they don't, they feel safer in it. So a consistent plan with structure, rules, how to use technology, appropriate use of technology, all of that stuff is going to be really, really important. The second thing for parents is educating ourselves, making sure that we're equipped to know what we're looking for. What does anxiety look like? What does depression look like? What is trauma? What does that mean? And then, knowing what our kids, the expectations and who to contact. The thing about Rockford Public Schools is we have phenomenal staff who are here to help. So if a parent is frustrated, let's say in the high school, our school counselors are right there to support them, whether it's a class issue or instructional issue, or even use of technology. We have awesome resources to support our parents. So there's nothing that we can't handle. We don't know. We can't help unless we know. So it's more of educating yourself, knowing those resources in the school and even in the community, communicating with your primary care doctor, mental health professionals. If your child already has a therapist, communication with them, and even with school staff, letting us know how we can help. My role is primarily an advocate for families. So I'm here to support our families in the community, no matter what the issue is. And that's with complete confidentiality. So, and then also having a plan in place, like knowing, what do we do? What if this isn't working? What should I do? Knowing you can contact your school social worker, or you can contact that building administrator or that school counselor to get other options of what we can do to support them. So we want to be proactive and preventative rather than just be reactive and like letting this go by.
And with that, what I can say is, as a school social worker, I've had parents call when we were in school saying, you know what, last night was a really rough night for our family. Some weird things happened. Just want to let you know, our daughter may have a really rough day at school today. Or, hey, we lost a family member and there's going to be some grieving going on. So if the student needs someone to reach out to them, just want to give you a heads up. So if you can find someone that you trust in the school system to communicate those kinds of things to, then it takes the guesswork out of the school staff. And we can kind of just jump right into supporting without saying, what is happening? Why?
So how would you recommend that parents go about putting a plan in place? Should they be looking up phone numbers or trying to identify where they will go? I know that you'll be talking about resources in just a moment, but in terms of telling parents how to approach all the resources that are available.
Yeah, that's a great question. I think first, know your child's schedule. Right now, it's a difficult time because schedules are just coming out for various districts in our county. So getting information, going to the school, reaching out, getting your child's schedule, looking at structurally what that looks like, getting the information for those teachers, whether it's elementary and you have maybe 1 or 2 teachers, or secondary where you may have 5 to 7 different teachers, getting that information, knowing what is expected of our students, and then making sure you have emails and phone numbers for them. And then if our parents, as far as having a plan, if they have questions regarding mental health issues, we're going to give some resources tonight, but do your homework, reach out to your professionals at school, because no matter what district they're in, even if it's Northview or Comstock Park or Sparta, there's professionals in every district that help support mental health. So they will have a list of resources relevant for your district. So I would encourage you to reach out to your counselor or your school social worker or building administrator for those resources to develop that plan.
Okay. Jenna, did you want to add anything to that?
No, I think if we jump to the next slide, there's a couple more tangible things that our families can do. As we talked about earlier, those kind of 3 spheres of overlapping influence on our children's mental health and their lives. There's school, there's community, and there's home. But with this right now, home is going to have such a huge influence on our children's mental health because they're not necessarily out in the community and not necessarily at school. So what can we do at home to compensate for that? Like David talked about earlier, that building routines when kids know when they're going to be eating. Generally at school, every 2 hours, you're going to get some sort of snack. Building some sort of consistency there. So that's one less thing that they have to worry about. Are you sure this is happening? Again, with the sleep disorders, not sleeping enough, sleeping too much, that can throw off your mental health so significantly. So as much as you can to get in a good sleep routine, taking away screens at night to support sleep and healthy sleep cycles. And then the other thing that's on here is creating rituals and memories. Right now, it would be super easy to have these memories of remember we were at home and we all were yelling and screaming and crying the whole time, or remember when we were at home and we did this super fun game night and we started doing puzzles as a family, or we dressed up like crazy 80s night and had fun themed dinners. So take this time to really make your kids feel like they have a community at home. You guys are developing things, doing things that are fun. So when we go back to school, like, what's been going on since the last time we saw you? There's all of these fun, happy things that kids can think about that will balance out all of this negativity that we're experiencing. Another thing that's on here is setting up a workspace. And this is something that's going to be really important as we start. Rockford, again, is doing virtual school to start. And as David said, this anxiety can look a whole lot like ADHD with that lack of focus and inattention and hyperactivity. It's going to be hard for kids to sit down and really do their work. So as best we can, create a space that is school only. That when I sit down here, my brain kind of clicks into this is academic work time. This is time with my teacher. It's going to help with that transition back into the school setting. It's going to reduce the fights that you get in over doing schoolwork when and how. And it's also something that our students can kind of have some buy-in on. Like, what do you want it to look like? Do you want to design this? Do you want a fun picture here? What can you do to make that learning fun? And again, it's going to help with that routine. And the last thing on here, David did talk about a little too, is modeling and validating those emotions. I hear so many people saying things like, well, gosh, my mental health is shot. I don't know how I'm going to support my kid. Or, you know, I don't have any of the answers. I don't know what to say to them. And I think a lot of this is, yeah, you're right. We don't have the answers. We don't know. There's so much uncertainty, and how we handle that and how we react to all of this, that's what our kids want to see. So we talked a little bit about those mirror neurons. So when I'm looking at another adult, if I'm a kid looking at an adult, I'm going to do what they're doing. So if I'm saying as an adult, man, I'm really, really sad. I'm grieving the loss of the football season, and I'm just going to take a little bit of time to really be sad about this. I'm going to take care of myself by doing X, Y, and Z. And you're just showing kids that, like, yes, I'm having an emotion that isn't comfortable. No, I don't know the answer. I don't know what's going to happen, but we're going to make it through this together. This is something I can't control, and that's okay.
Who knows? Football season. Oh, this lady?
Football?
This is a
Oops, sorry. I just want to get back to, I think we lost Deb.
Looks like we did.
I
But
want
I'll-
to get back and see. Okay.
Review that last little point there is practicing that self-care and those self-rewards, and grieving those losses, because during this time people lost family members. There have been deaths, there have been this isolation, there have been very serious things that is a huge grieving process to go through, and there are smaller things that are just really sad that we're missing out on. And it's okay to be sad about losing those things too, and needing to have some sort of self-care around being disappointed that we didn't get to go to prom or whatever the thing is that we lost. And so practicing self-care. I've had a rough day, I need to go to bed early. Or you know what, I worked really hard today, I'm gonna go get myself some ice cream. Whatever it is that we are responding to ourselves and just validating that we're making through this just like everybody.
Mhm. All right. I don't see Deb back on, but I think the next slide is the resources page. Did you want to jump into resources, or did you want to, we have some specific questions?
The next slide is the mindfulness.
Oh, okay. Let's do that.
One. Mindfulness is something that I'm very passionate about just because there are so many benefits of it. If anybody's interested in learning more about mindfulness, it's something that you could just Google and there would be a million different resources for you. The image that we have here is just some controlled breathing, and breathing can change the way that our nervous system functions. It kind of slows our body down and sends a message to our brain to decrease that anxiety. Another really amazing thing with mindfulness is that it's going to help with that executive functioning and attention, which is what we see with those ADHD-like symptoms. So again, what we've been talking about, doing this mindfulness consistently, practicing it, even in small chunks, is really going to make a big difference for ourselves and for our children.
Okay. All right.
And Nan, if you want to click on that link, I can explain it to the viewers for a few minutes quick.
Mhm.
So what we also have here is just a resource guide that we feel is important to know. This is part of the planning process as well as a parent to prepare ourselves for the mental health side of this. We're going to get in touch with our school staff to know what's expected on the school level. But if we're needing support outside of school, it's important to know what's in our community. We're blessed in Kent County, in our Grand Rapids area, to have a lot of services. So we started, Jen and I, with the most acute. So obviously with Helen DeVos Children's Hospital, if it's an emergency and you need your child seen immediately for a medical rollout, for any level of safety issue, if you are just super concerned and it cannot wait, don't hesitate to call 911 or go to the emergency department at Helen DeVos downtown Grand Rapids and get the help that you need. What they do is they'll immediately bring you into triage, and from there they'll put your child and yourself into a room, and they'll have a clinical social worker work with you, along with they'll have the attending doctor, nursing staff to look at pretty much the presenting concerns, and then they'll manage the care from there. They can make referrals to Pine Rest, to Forest View Hospital, and I'll explain Network 180 in a minute here too. Any of those services they can refer to from there. But the immediate support and stabilization is important for safety first. Then it buys us time to make sure we do the right thing to look at what's next. The next one underneath that is going to be Network 180. Network 180 is Kent County's community mental health. They are kind of the brain of mental health in Kent County. So any family with no insurance, Medicaid, or even if you have commercial insurance and don't have mental health coverage, you can go to Network 180 or call there, and they can set up an evaluation for you to be seen. They deal with adult services, children, substance use. They can authorize hospitalization. They can authorize any level of mental health care from there. So they are the kind of the governing body for funding for mental health in Kent County. So they're phenomenal. They're located right downtown Grand Rapids as well. And they have resources and partners with pretty much every agency in Grand Rapids and in Kent County. The next one is Forest View Hospital. it's like Pine Rest. Well, let me talk about Pine Rest really quick. Pine Rest is the largest organization for mental health services in our area. They do have inpatient care, partial hospitalization care, which is a day program for adolescents, for children, and for adults. They also have this really cool tool called Central Access, and it's an outpatient support where you can call and get a support staff on the phone, and they can help you navigate setting up a first-time outpatient appointment for yourself, for your children, for anybody. They can check insurance, they can check scheduling, they can schedule testing, they can pretty much access any resource in the under the umbrella of Pine Rest. As far as inpatient services or more intensive services, that would be the contact center that you're seeing right there underneath that. Forest View Hospital is another great agency that does similar work. They have inpatient services for adolescents and for adults, partial day programming as well. And they also have outpatient psychiatry services, so med management. So they do a lot of that as well. They also have an expertise with eating disorders and trauma and co-occurring disorders. What I mean by co-occurring disorders is substance related typically and a mental health disorder, and that are going hand in hand. Sometimes even dual diagnosis. So people might have more than one level of diagnostic criteria being met, so varying diagnoses. Moving down a little bit, there's some other smaller practices and outpatient. So Wedgwood is also here in Grand Rapids. They're awesome because they provide some expertise with testing, with adolescent substance abuse services. They offer support for trauma, abuse, and neglect. They do have residential programming. They specialize in a 6-month dialectical behavior therapy or DBT program. That's super helpful. And they are the home of Lighthouse Academy and Hope Academy. So those are educational environments for more at-risk students, but great programming there as well. Underneath that, the Children's Advocacy Center, it used to be the Children's Assessment Center, the CAC, just moved down Michigan. They used to be closer to downtown. Now they're further towards the Beltline. And they specialize in advocacy for victims of abuse. So they do awesome forensic assessments and family advocacy. They can provide free therapy services, trauma-based services, and education for families and for students. Great resource. An outpatient office close to our area, the north side of Grand Rapids, is North Kent Guidance. They have some really, really, really cool clinicians in that practice. They do some testing. They do accept Medicaid and private insurance. And they have clinicians there. If you look at their website, they have bios on their clinicians. And they have expertise in varying levels, from eating disorders to gender identity to depression, anxiety, you name it, co-occurring. They have some really, really awesome providers in that practice. The same with behavioral health partners. And so this list is for all of you. The last one real quick is Brains, and they have some great services as well, including ABA, some testing, and some trauma-focused work. So this one right here, actually, this document also has my contact information on it for Rockford Public Schools. And if there is questions or concerns for Jenna or myself, please let us know if we can help or direct you in a place that would be supportive of you. If you're in other districts besides Rockford, reach out to your school staff, like your administrator, your school counselor, or school social worker. Most school districts are very well equipped with mental health resources and school-based resources for your family.
Okay. Well, that was a weird little moment. Nothing like live Zoom. Yeah, I would like to follow up now, and thank you so much for just carrying on there. I figured out what was going on here. I know that there have been questions that have been submitted by folks online, and Jenna, could you take a moment? I know that you had actually pulled a couple of those that you wanted to respond to. You kind of let us know where we're at with that.
Sure. You know what? I actually can't see them. I was going to see if Nan was going to.
Oh, okay. One of them was how to help children deal with the loss of activities, which it seems to me we've probably covered very well. But how do parents continue to be seen as in control when we've lost control of so much of our current situation?
Yeah, and I think a lot of this goes to we're all in the same storm, right? Like we may be all in different boats, but we're in the same storm. And so we don't know what school is going to look like. We are being told that it's going to be virtual for 3 weeks. We don't know if we're going to get sick. We don't know what's going to happen next, and neither does anybody else around us. No one can give us a definitive answer that we're looking for. And so again, we're validating our emotions and how we are going to have concerns, we're going to be anxious, we're going to be sad. And it's not wrong to have any of those emotions, but what we can do is control our reaction to it. So what can we control? What can't we control? And sometimes it's just saying that. It's just like, wow, I am overwhelmed. I don't know what's happening. I have more questions than answers. I hate everything and I'm having a bad day. I need to go take a break. I need to go on a walk. I need to set my phone down and not think about this for a little bit. And then kind of come back and be like, okay, I took a break. I feel a little bit better. I'm just accepting that I can't control this. And what I can control is that on Monday, we're going to start virtual learning. So let's get ready for that.
So do you think that parents can also, have that direct conversation with their children when they're saying, I don't feel like I'm in control either?
Absolutely. I mean, I think that's the best way to kind of validate and model that everything's going to be okay, even if I can't tell you how or why.
Okay, well, fair enough. Here's a question that I find very interesting. Will the current situation damage parent-child relationships?
I'll answer that, Dr. Havens. I think this whole pandemic, this whole situation, we can handle it in 2 different ways. Life is going to throw a lot of things at us. We have a chance to learn from this, get stronger and grow, or it can damage certain relationships if we let it. So that's one thing I'm trying to foster with my own children and foster with families that I'm working with is, yes, this is difficult. Yes, there's a lot that has been changed and adjusted and we lost, but at the same time, we need to get through it. We need to persevere and show resiliency and fight through it like we would other things that people have gone through before us. This is very difficult, but it's something we can manage. So I think being uplifting, showing confidence and instilling confidence in our families and our kids, it could actually make us get closer. The thing that's been good about this is we've spent more time as a family. We spent more time at home. We spent more time not running around. We've realized we can do a lot more with less. I've had a lot of families report that to me, like, wow, I realized I didn't need to be out going out to eat all the time or going shopping all the time, or I can stay home more and be content with just playing a game with my child, or like Jenna said, doing a puzzle. There's a lot of things we can do to be creative, to go back to where we almost got lost with technology and with this busy schedule where we were doing a million things rather than just staying home sometimes and just enjoying the simple things, like just being with our families. So I think there's a lot of benefit and a lot of really healthy, positive things that can come out of this and not just the negative. I think if we let it go that way and our perception is on the cynical, pessimistic side, then it can be. But I think it's our choice to make it positive and healthy and make the most out of this situation. Because if you look at it, there has been some things that have brought families also together.
And with trauma, we know that building relationships is one of the most effective things in building that resilience after trauma and having strength in your family and your friends and your social connectedness. And so this is an opportunity to, like, for sure, you're going to get mad at your kids. They're going to do things that are going to be really frustrating, but this is also a really great opportunity to build that relationship even in the face of adversity.
One of the things that some of the parents, I was listening in to some of the school board meetings, and some of the parents were voicing concerns about the possibility of suicide, that children would be so bereft or so uncertain about the future ahead of them that they might have that conversation, or certainly they had that concern. So how would you address something like that?
We definitely need to be aware of what's going on with our children. So like we talked about earlier tonight, paying attention to detail, making sure that we are paying attention to changes in our children. So the thing about that is you're right. Could that happen? Could that incite more severe depression because of isolation, because of lost opportunity? For sure. Could that lead to students feeling like that's their only way out? Potentially. So what we need to do as parents and educators is to pay attention to what's going on with our children. And if we feel like there's something that's off or wrong, then we need to seek out help. And like we said earlier, be proactive. So if I'm noticing in my kids significant changes in their behaviors, their habits are changing, they're not them anymore. Like we know our kids, we know our students. We need to take action. We need to ask for help. We need to talk to them. I know a lot of parents and students in their kids, the kids are isolated in their rooms on their phones. Go in there and talk to them. Get your eyes on them. Are they eating? Are they sleeping? Are they showering? I mean, do they look healthy? Are they hanging out with positive kids and peers? Are they using or abusing drugs and alcohol? All those things are factors that we need to take action on early enough and proactively so it doesn't get to that point where people are making an attempt, because there's a progression there, Deb, as well. Kids just don't wake up one day, or adults, and say, now I'm thinking about taking my life. There's a progression there. Some of them are impulsive. You know, I worked in the hospital long enough to see a lot of cases where kids impulsively reacted to something on social media or something too. But that's why we need to pay attention to what our kids are doing and who they're talking to and their mindset, where they're at. So if something is going on, we can get them the help that they need before there's an attempt.
Well, that's really good advice, and I hope everyone is really paying close attention to their children right now. I really would like to say too that we don't want to frighten people unnecessarily, but the bottom line is to pay attention. Mm-hmm. And Jenna, did you have something you'd like to add there?
No, I think that David said that all very well. I think that there's going to be a lot of times during this, and just for people who have adolescent children, where your kids are going to yell at you and they're going to get in a fight and they're going to say, get out of my life. They're going to want that privacy. So what are you doing, again, to build that relationship where children are comfortable coming to you and being like, listen, I tried alcohol. Let's talk about it, so that you can have those open conversations and they're not afraid of confiding in you. Again, this is just a relationship building thing that's going to be really hard.
And watching our reactions too. Like if our children come to us with sensitive information, how are we reacting to it and what are we doing about it? Because if they have the confidence to come to us, we need to have their backs. We need to support them, and we need to not overreact, because if we do, they're never going to come to us again. If our child comes to us and says, yeah, I did this, I'm sorry, I made a mistake. Instead of me blowing up on them and screaming, it's like, okay, I may not be happy about it, but staying in there and talking about that and educating them on why it's not a good decision, and then getting them help. Those are those moments, those teaching moments that can be life-changing for them, because they need to have that trust in us that they can come to us with anything and we're going to handle that. And we may be disappointed, we may be angry. Those are normal feelings and emotions attached to it. But we need to make sure that we are supporting them through these tough times. And we need to be empathic to our kids. We've been there before. We've been 15, 16. What was that like? How difficult was that to be going through those stages of life and making mistakes and not knowing? Having our parents there to support us is huge. So sometimes we have to kind of look back and be like, yeah, I made mistakes too, and that's okay. And sometimes apologizing to our kids is a good thing. When we make mistakes, when we overreact, or we do things that we shouldn't, letting them know like, hey, I'm wrong too, but I'm trying to be better. And we need to model that to them.
Yes, because definitely nobody's perfect.
Exactly.
Nan, how are you on time?
We are doing good. We have a couple more minutes, but we have a suggestion in the chat from a guest in our Zoom, Joan Long, our friend.
Joan.
And Joan suggested for parents that they can possibly tap into some other resources they might have. For example, utilizing grandparents, perhaps setting up a regular reading time with grandchildren online so that parents can have a bit of time off. And sometimes grandchildren feel that they can share feelings with the grandparent that they may hesitate to share with their parents.
That's a very good point. As a grandparent, I every once in a while get a call from my son saying, "Hey, would you talk to?" There's a little problem going on, and I can't talk to her. So I'm always happy to jump in there. So that's a great suggestion, Joan.
And is there anyone in our Zoom live with us that might have a question in our last couple of minutes?
Well, I do have a question, and it is kids who are special needs. Certainly, we're potentially going to have some special issues. Can you speak to that in the last few minutes that we have here?
Sure, I'll kind of give a general answer because it's going to look very similar to everything that we talked about. A lot of our kids with special needs may also have these diagnoses. A lot of those are co-occurring. Autism spectrum often comes with anxiety or an ADHD diagnosis. So a lot of this is going to look the same. Now, what's different is that those kids may not be able to process what's happening like our other neurotypical kids could. And they may not be able to verbalize it. So you may see more physical aggression or physical outbursts or those physical symptoms. And that's just another clue that something's off. This goes back to this idea of know what's going on with your kids. Know that you can say, look at them and be like, something is off, something is going on, and just trying to communicate to them with your emotions and with your body and reactions that everything's going to be okay. Again, even if we can't explain how.
Any other questions that have come in, Nan?
No, no other questions. And it looks like we are at just about our ending time. Deb, do you want to tell us where we can find this recorded Zoom tonight?
Yeah. Yeah, thanks, Nan. The recording is going to be posted on my website, which is electdebhavens.com, and on my Facebook page, Deb Havens for Kent County. And I just really want to thank the children's mental health professionals who joined us tonight, David Jangda and Jana Shapiro. And I want to say it's very reassuring to know that our children do have access to folks like you and other folks in the school district liaison position to really help parents and students as we go through this very difficult time ahead of us. And thanks to everyone else for watching. We certainly hope your children and you have a very successful, healthy school year. But if you have issues, hopefully you have a little bit more information about where to go for assistance. And for information about me or my campaign, you again can visit the website, www.electdebhavens.com. And I want to thank you again for being with us, and good evening.
Thank you. Thank you. Thanks, guys.
Thanks, Nan.
Thank you. Appreciate it.
Great job, Nan.